My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Hello, everyone. Thank you for joining us for another episode of the DO or Do Not podcast. My name is Akito Nickel, and I'm a fourth-year student at the NYIT College of Osteopathic Medicine pursuing a career in diagnostic radiology. Today, we will interview Dr. Thomas Cavalierey, the current dean of the Rowan-Virtua School of Osteopathic Medicine. Dr. Cavalierey graduated from the Moines University College of Osteopathic Medicine, after which he completed an internal medicine residency at Thomas Jefferson University Hospitals. Under his leadership, the Rowan-Virtua School of Osteopathic Medicine has been named one of the best medical schools in the country for primary care and geriatric medical education. Dr. Cavalierey has also recently been selected to serve as the inaugural Senior Vice Provost of the Virtua Health College of Medicine and Life Sciences, as well as a Chief Academic Officer for the Virtua Health System. It is a tremendous honor to interview such an accomplished physician, and I believe his perspectives would be valuable for everyone from pre-medical students to attending physicians. Without further ado, here is Dr. Cavalierey.
How you doing?
Doing great, Dr. Cavalierey. How are you doing?
Good, good. Gee, I'm sorry I'm late. Apologize.
No, it's absolutely fine.
And how are you doing? Are you a NICOM student?
I am a NICOM student. I just found out on Monday that I will be a diagnostic radiologist, so I am over the moon.
Wow, congratulations.
Thank you so much.
Yeah, that's good. So where'd you match? No, you don't know yet. You know you matched, but you don't know where. Okay, you'll find out Friday.
Yeah, so that's basically Christmas for me at this point. I'm already happy.
Wow, that's great. Congratulations. That's wonderful. So far, we're doing pretty well here. We have, I think about 95% have matched. And of course, we're expecting the rest in the SOAP process. But I think a 95% first match rate's pretty good.
That's pretty excellent.
Yeah. So I'm happy for you. That's great. It's a pretty competitive field.
It is, and it was considerably stressful just leading up to it. There was always the chance that I wouldn't match, and that was something I was prepared for. But we made it.
It's a big day, big time, and so we're gearing up for Friday. So you guys have a big match day celebration there, I'm sure.
Yes, we do. All right. Well, Dr. Cavalierey, thank you so much for joining us today on the Do or Do Not podcast.
Great. Well, happy to be with you. Looking forward, Keto, to our conversation, and appreciate the opportunity to talk about my career and life as an osteopathic physician who chose a career in academic medicine.
Absolutely. So let's just dive right into it. As I understand, you have different roles as a physician and a leader, but what does a normal workday look like for you? So please just start in the morning, take us through your responsibilities, and if you have different types of days, tell us what those are like.
Well, that's a difficult question to answer because every day is different. And you basically have been dean for, it'll very soon be 17 years. I just transitioned into a new role as a Senior Vice Provost here at Rowan University. The day of the dean is very variable. I like to start early. I'm usually in my position here at 7 a.m. Sometimes early morning, before there are too many people here, are the best times just to think and get some work done. And just a little time I'm going to use the word meditation. I think it's mindfulness. I think I like that concept of mindfulness or prayer or just a time to be alone and meditate. It's a good way to begin the day. So I begin at 7 a.m. and start out with a little private time of maybe mindfulness to begin the day. Every day is different. Attend a lot of meetings. As dean, I still am involved in education. A lot of my time might be spent mentoring our chairs in our different departments here. I think mentorship is very important in what we do. So as a dean, I might be involved in mentoring students, residents, but mentoring chairs of our departments to help them move forward in their leadership pathway in academic medicine is something that I do. Obviously, as the dean, you're also the chief executive officer and chief academic officer of the medical school. So I would have oversight over all of the academic issues that relate to the school. So you're involved in many of those meetings, whether it's the curriculum committee or student academic progress committee. So you spend time with that. I oversee a research enterprise here too, so to assure the research is moving forward. You know, one of the big things with the role of the dean is to really work as a community here to set forth the mission of the school and its values. And I always say that that's a critical role of the dean, to be sure that we are truthful to our mission and that we're living our values. So you do that through communication, through role modeling, and through strategic planning. So every day is different. But one thing that I will say that might be a little different about what I do compared to many other deans is I still see patients. I still see patients. It's only a half a day a week, but I think it's very important. In fact, we have a number of assistant and associate deans here, and all of our deans who are physicians keep their hands in clinical care. This is why we became doctors, to care for people. And I think it's even good role modeling. It's good for our students to see their dean caring for patients, communicating with patients, being the type of empathetic physician that we as DOs aspire to be. So despite my very busy day, I have a half a day a week where I see geriatric patients. That's my field. And fortunately, I have colleagues in geriatrics that when I'm not there, they're able to, you know, obviously, if you're going to see patients, you need to be available. As dean, you can't always be available. I'm fortunate to have colleagues that help out with that. So the day is full, mentorship, strategic planning, meeting after meeting, but always make time in the week to see patients.
Just as an aside, I have tremendous respect for that. I think that it's truly leadership by example and not giving up your role as a physician, especially when I'm sure many of these patients you've been seeing for a considerable amount of time. I think that speaks a lot about your approach to academic medicine. Now, you did actually touch on this, but for those who might not know, Rowan University recently partnered with the Virtua Health System to create a new academic health system. And you were named the Senior Vice Provost and the Chief Academic Officer, but what will these new roles entail?
Good question. I'm just starting out on the job.
I know, I got you on the spot.
It's a new job. So we have a tremendous opportunity here. Virtua Health is a top-notch health system, the largest health system in South Jersey with 5 hospitals. And Rowan University, of course, is a publicly funded research university. And we are, the School of Osteopathic Medicine is one of its 2 medical schools, the Cooper Medical School and the School of Osteopathic Medicine. The partnership with Virtua involves Rowan University and Virtua Health. And it includes 3 schools within Rowan University. Our School of Osteopathic Medicine, It includes our School of Nursing and Health Professions, and it includes a new school called the Rowan-Virtua School of Translational Biomedical Engineering and Science. It's a very, very research-focused entity. Whenever there is a union of a hospital system and a university to create an academic medical center, what that means is strategic alliance in mission. So the two have joined together for excellence, patient care, excellence in health professional education, and excellence in research. And what that means is that both entities, the university and the hospital system, are fully committed to that mission. Very often when medical school partners with a hospital, the hospital is very focused on clinical care, and they're looking for the medical school to help out with the teaching. In an academic medical center, there is an alignment of mission between the three entities, all hands on deck for research, education, and clinical service. So this is a tremendous opportunity. Most of our osteopathic medical schools are very community-based. On the MD side, the MD granting degrees, most of the medical schools are academic medical center based, but some of them are community based. This is an opportunity for us to create an academic medical center here. So I'm really excited about it. I stepped out of my role as dean, and now I'm the Senior Vice Provost. And what that means is that I will really have the oversight of integrating these three schools, nursing school, health professions, the research school, and the School of Osteopathic Medicine, in partnership with Virtua to move forward with that mission. And it's all aimed at transforming health here in South Jersey and beyond, training the next generation of physicians and nurses and other health professionals, new discovery through research, excellence in patient care. But at the very center of all this is the patient. It's the patient. It's to improve the patient experience through education, research, and clinical care. With research, we would be looking for innovation, new ways to improve care. So always at the heart of this is the patient. And one thing, if I could just add, that I really am excited about this, is that this hospital system, Virtua Health, when they talk to the community about this new relationship, here's what they say. We care for the whole person, mind, body, and spirit. This health system has adopted the osteopathic philosophy to care. And I'm very excited about this opportunity for our students, for our profession, and for the community we serve.
So you actually touched on this earlier, but one of the comments that's often made about osteopathic medical education is that compared to our allopathic counterparts, our schools, again, don't often have an affiliation with an academic health system. And some people will question how this affects mentorship and research opportunities. In your opinion, what impact will the new partnership between Rowan and Virtua Health have on the preclinical and clinical experiences of our osteopathic classmates over at the Rowan-Virtua School?
It's a very good question. I think it'll have a tremendous impact. First of all, we become the academic partner to the largest health system that has 5 hospitals. So this will create tremendous opportunities to expand clerkship sites for our students. Just to give an example, in women's health, in South Jersey, Virtua is the place to go. I mean, they have 10,000 deliveries a year. That's a lot of deliveries. And they have an OBGYN residency. So, a lot of times students have difficulty getting OB rotations that really are very active with a lot of deliveries. So that's one area, clerkship opportunities. The other thing is this health system has both primary care and tertiary care. So one of its hospitals is the lead with regard to heart care here in South Jersey. So they're the busiest in place in terms of cardiac care. They also are the transplant destination, renal, hepatic. So our students will have opportunities to both primary care as well as tertiary, even quaternary care in some of these areas as well. So that's an important thing. As part of this relationship, too, we are partnering with Virtua to develop new graduate medical education programs. They just launched internal medicine. They've launched surgery. They have OB and family medicine and others. So GME growth is very important. As you probably know, it's very important as a profession that as we grow our medical schools, that we need to grow graduate medical education. So new GME opportunities will result. Also, with our involvement with the nursing school and other health professions, it will create an environment for interprofessional experiences for our students, which are very important. The other thing is that in this whole relationship, Virtua has actually made an $85 million gift to the university to support research for this academic medical center. So what we're going to see are more and more opportunities for our Rowan-Virtua SOM students to get engaged in research, which could be very clinically focused research or even bench research as well. So this is going to open up a lot of opportunity over time. We do have a DO PhD program in biomedical sciences and even biomedical engineering. So it will obviously offer a lot of opportunities for our SOM students.
Well, I think it goes without saying that our osteopathic colleagues over at Rowan-Virtua have a very, very bright future to look forward to. In that regard, I understand that you are kind of on your way out as dean, but for our pre-med listeners, feel free to tell us, what else is great about the school and why that should be their top choice for an osteopathic medical education. This is definitely your opportunity to sell it, to brag about it. I mean, there's already a lot going on here, but.
First of all, I would encourage any student interested in medicine to really consider osteopathic medicine. Whoever speaking to pre-medical students, osteopathic medicine, I believe, is the type of physician the nation needs at this time. We are trained holistically to care for the whole patient. We are trained to look at the patient as mind, body, spirit. I would encourage students who are interested in medical school to give serious consideration to one of our osteopathic medical schools, because I believe it's the type of care that our nation needs at this time. Now, yes, we say many of our graduates go into primary care, and they do, but many of them also go into every specialty you could imagine. And I encourage everybody to find out what's the best fit for them, primary care or specialty care. But even if you go into a specialty care area, a specialist, like I understand, Akito, you're going into diagnostic radiology, right?
Yes, sir, I am.
That's tremendous. That's good. But your osteopathic training will always give you the background of caring for the whole person. And you'll bring that even to your role as in diagnostic radiology. It's important. Remember, we're caring for a patient, not a lab test, not an x-ray. It's a patient, not a disease. So first of all, I really want to say that osteopathic medicine offers a career choice to become a physician that I think has a lot to offer our nation right now. Separately, our school here we are known to be very diverse. I mean, we have been a champion of diversity before it's even been spoken of. I mean, I say that. We have a very diverse student body. We have about 20 to 25% of our class come from those underrepresented in medicine. We celebrate diversity here. But this isn't something that we just started 5 years ago. It's been part of our culture for many, many years. So I would encourage any students who are looking for a school where diversity is celebrated, this is for you. Obviously, with our new partnership with Virtua, offering new clerkship sites, that's an attraction. But I do want to say that no medical school, even in academic medical centers, they all have other hospital partners. We have hospital partners up and down the state of New Jersey, and even into Delaware at the Wilmington VA. So our students can really have opportunities to rotate here at Virtua, our academic partner. But also there are many community-based hospitals that we partner with up and down the state. So I think we offer that more academically oriented sites to train as well as community-based experiences. Both are very important. Both are very important. Also, you heard me speak of our research, development here. We are a osteopathic medical school that is research intense. And I'm happy to say that our osteopathic schools, our COCA, our accrediting body, expects osteopathic medical schools to contribute to new knowledge, and that's great. We happen to be one of those schools, though, that I'm going to use the word research intense, and I mean that a lot of opportunity that is really demonstrated by our faculty contributing to peer-reviewed literature in high-quality journals and attracting extramural funding from NIH, HRSA, National Science Foundation, et cetera. So all that might be an attraction to students who might want to come to an osteopathic medical school that is a little more research focused. Once again, I am proud of all of our schools, our osteopathic medical schools, but these are some of the things that might differentiate us. The other thing that I will say, and as part of our mission, along with excellence in patient care, collegiality, innovation, and diversity, is a true commitment to the underserved in our communities. We don't give that lip service. We really reach out to those underserved. Let me give you an example. When we developed the Rowan SOM COVID-19 vaccination center, we gave 60,000 shots on our campus. But it wasn't just that. We brought those shots to inner city Camden. We brought them to Atlantic City. We brought them to the homebound patients. We brought them to migrant farm workers and to homeless. That's an example of how serving the underserved is part of our culture and part of the training of our future physicians. So what might differentiate us and choose our pre-med students to want to consider Rowan? Any of those things. But I can't underestimate how strongly I believe in an osteopathic medical education at any of our schools.
Wow, you're making me feel like I wish I was at Rowan, actually. That's actually a very good segue point, too, because now that we understand what sets your institution apart, and now we understand how strongly you feel about the importance of osteopathic education, and I entirely agree with you. Now I want to talk about you and your story. What made you decide to pursue a career in osteopathic medicine?
I chose a career in osteopathic medicine because of a very positive experience during college with osteopathic physicians. It's this simple. I knew I wanted to be a doctor. I really didn't know or understand DO versus MD. All I knew is I wanted to be a doctor. During college breaks, summer, etc., in order to get more experience in the field, I secured a position in our local hospital called Kennedy Memorial Hospital they gave me the title of an emergency medicine technician, which basically was an orderly in the emergency room. Hmm. This was an osteopathic hospital. I didn't know that. When I got into the ER there, and it was really an immersion into this field, there were interns there, most of them from PCOM. And they were really, things were a little different back then, but they were pretty much running the emergency room with some peripheral supervision. But they took me under their wing. They mentored me as an aspiring medical student and guided me. But wow, I was so impressed with them. The way they cared for patients, the way they communicated, how they tried to really spend a little time with me to encourage me. And I, quite frankly, said, this is the type of physician I want to be. So when it came to apply to medical school, I applied to DO schools. I wanted to be, of course, I saw other physicians there too, just not interns. There were surgeons, internists, they were all DOs. And I saw what I liked. I saw the way they communicated, cared for, and handled patients and the collegiality amongst them. So that pushed me to the DO pathway. And I'm very grateful for that. If I didn't have that experience, I might have not been a DO, right? So I'm grateful to have had that opportunity.
And that's an incredible story. Where did you end up going to osteopathic medical school then?
I went to Des Moines. Des Moines, what's now Des Moines University. It was the College of Osteopathic Medicine and Surgery in Des Moines at the time. Now it's Des Moines University. And when I was in college, I got an early acceptance there. I grew up here in South Jersey, Philadelphia area, so it was a little culture shock going out to the Midwest in Des Moines, but it was a great experience. Quite frankly, I had a very early acceptance there. When I went out for the interview, liked what I saw, and I was college, I said to my parents, this is where I want to go. And it was a great experience. It was a great experience. So that's what brought me there. And at the time, it was a great education, and it only affirmed what I saw in the emergency room through the DOs there in practice. And there, of course, learned osteopathic principles in practice, learned some OMM, and it was really a wonderful experience. And I greatly valued my experience there in Des Moines. And at that time, when it came time to the clinical clerkships, we had a lot of opportunity to go in different sites, audition rotations, not unlike our students do today. While I was at Des Moines, there was a hospital in Dayton, Ohio that was a major partner with Des Moines. So I did many of the third-year clerkships there, and that was a great experience. Wherever I went in the osteopathic training, it only affirmed my commitment to osteopathic medicine through those experiences.
At the time you were at Des Moines, did you encounter any special friends, any mentors, and anyone who would ultimately help guide your trajectory towards your field of choice, which ended up being geriatrics? How did you end up pursuing that?
What I would say, my years in Des Moines were there were many great role models there. I would say, though, that I was fortunate enough that when I was in Des Moines and we had some latitude to do rotations in different sites, I returned to this hospital where I got my first introduction to osteopathic medicine, Kennedy, where I did a number of rotations in internal medicine. There, I saw some amazing internists who really attracted me into the field of internal medicine. Dr. Jim Judijay is an example. In fact, believe it or not, he's on our faculty here today. Amazing pulmonary
Amazing.
guy. He was probably the first DO to be trained in pulmonary medicine at Hahnemann Hospital here, Hahnemann University Hospital in Philadelphia. This man has a tremendous legacy of training internal medicine residents over the years. And believe it or not, I have to say this, at 80 years old, he's still seeing patients and still training residents and fellows. So I think, like most of us, many people inspire us, right? But I remember as a third-year Des Moines medical student rotating on his service, it was just amazing because there was a lot of bedside teaching. There was a lot of good care for patients. At the end of the day, after a busy day of rounding and seeing the caring and the bedside teaching, we would end the day with an academic discussion that very often involved internal medicine resident, students on service, very much a nice clinical learning environment. So what I saw for me in internal medicine was the ability to solve complex clinical problems. That's often what internists do. You're solving clinical dilemmas very often, and then caring for the patient, instituting care. I liked internal medicine because it was bringing together hospital medicine and the challenges of caring for really complex cases. Over time, so that kind of inspired me in a sense to go into internal medicine. But as time went on, when I pursued training in internal medicine, now when it came time to go into residency, I went to Thomas Jefferson University Hospital in Philly. So, my experience was both community-based, like I had here at Kennedy, then into an academic medical center. So there were few DOs there at the time. I was the only DO in the internal medicine residency program, but I felt I fit right in, okay? So I received my training there. Over time, I liked the idea of internal medicine because I liked hospital medicine. At the same time, I liked primary care. Now, at that time, if you went into general internal medicine, you did a combination of hospital medicine and outpatient medicine. And I like that. Of course, it's a little different today where not many people do both, okay? Because there's hospitalists and then there's primary care internists, and very few people do both. But at that time, I was attracted to the idea that I could have my own primary care patients as an internist, but yet care for them in the hospital. So what happened over time was after a short experience in private practice, I was offered a position to come to this newly created School of Osteopathic Medicine, what was called CMD, the College of Medicine and Dentistry of New Jersey, to pursue a career in academic medicine as a general internist. Because of some experiences in the private practice setting where it was such a busy practice that I felt I was not able to spend time with my patients. Early on in my career, I left that opportunity and chose a career in academic medicine. And it was really one of the best choices I've ever made because I love academic medicine, and we could talk about that later. But after being here for a while now, this goes back to the early 80s. There was not a defined field of geriatrics. Our visionary dean at the time, Dr. Ben Cohen, I remember him saying, Tom, he said, geriatrics is going to be big someday. We need to get into the field. Are you interested? Well, it didn't take me long to say, wow, yes, I am. Now, the reason why I did that is because, number one, I rapidly realized in academic medicine, to really succeed, you need a niche. You need something that you're leading, that you're developing. But not only that, as a general internist, much of my practice was already caring for the elderly. And I found that I liked caring for older people. I liked helping them. I liked what you can do for them. It was a myth to think there wasn't a lot you could do. There's a lot you can do. I liked how thankful they were. I liked knowing them as a doctor-patient-physician relationship. I liked seeing them over time. I liked getting to know their families. And what an opportunity it was. Now, at that time, there were not formal fellowships. So I did a series of what we're calling faculty development programs. I went to Mount Sinai for geriatric courses. I spent time at the Philadelphia Geriatric Center. And as a result, the first time geriatric boards were offered, I took them, and then I became certified in geriatric. Internal medicine certification with a certificate of adequate qualifications in geriatrics. That was in 1988. So any field, when it begins, any field, cardiology, pediatrics, et cetera, it doesn't begin with certified people. It begins with people that develop it. So I was amongst the very first people in the nation to be certified in geriatrics. And that began my career in geriatrics. And listen, it gets back to all opportunity that this profession has given me, and et cetera. So that began my career in geriatrics. And it was an exciting opportunity that opened up many other doors.
And what an incredible story. It sounds to me like you were effectively a trailblazer in the field, because like you said, at the time, there was no dedicated fellowship to it. It had to be developed.
Well, as a result of that, we started the first osteopathic geriatric fellowship right here.
Right at Rowan is the first osteopathic geriatric fellowship.
We began as a school in the College of Medicine and Dentistry of New Jersey. And in that school, in that college, there were three schools: New Jersey Medical, Robert Wood Johnson Medical, and the School of Osteopathic Medicine. That eventually became the University of Medicine and Dentistry of New Jersey. And then under Governor Christie, he reorganized higher education, and UMD&J was disbanded. Those two medical schools, Robert Wood Johnson, New Jersey Medical, went to Rutgers, and we went to Rowan. And it's been a great home for us. We have a president that loves osteopathic medicine. Now, we do have an MD school, but he will publicly say, my doctors are DOs. So we're in a good spot here.
Sounds like it.
Yeah.
And you touched on it earlier, but you mentioned that your involvement in academic medicine has been one of the best decisions of your life. But if you could just go into that a little bit, we'd greatly appreciate your insight.
Sure. So I kind of fell into the career, like many of the things that have happened to me, like even becoming a dean, weren't something that I set out. I have a dream to be a dean. Okay. My only dream was to be a doctor. Okay. That was my dream. So a short experience in private practice, joining a practice that was way too busy, that did not allow me to do what I set out to do. And the word is care for patients. Okay. So when I got offered this position to a career in academic medicine, it was an opportunity to get out of what I was doing and start fresh. So in this environment, and sometimes academic careers may vary from place to place, but here was my experience here. I started as a young internist. We had a faculty practice plan, which meant that the faculty that were teaching students were also caring for patients. And it started out that I was in an environment where, gee, I'm able to see patients. I could see them in the hospital. I could see them in the office. But as part of my role, it was teaching medical students and teaching residents. And I thrived on that opportunity because it kept you sharp. The day was very interactive and dynamic. It was never boring. It was always exciting. It was always about the patient. And then also, I got to do a little lecturing to first and second year students. So I now was developing myself as a teacher, learning how to develop lessons, goals and objectives, lesson plans, things like that. At time, I realized that if I want to have a career in academic medicine, there's a pathway to get promoted, to go from assistant professor to associate professor, professor. And once you choose a career in academic medicine, that's kind of the trajectory that you want to go. You want to grow in your career. So that brought into things that were very academically oriented, like developing new courses, a course in geriatrics, developing a new clerkship. But it also involved a little publishing, writing, review articles, case reports, and then eventually getting involved in some clinical research as well. All of this I found very exciting, but it was always, never lost sight of the fact that it's always about the patient. So even for me as an academic physician, I'm caring for the patient, still what I do today, but yet I'm helping to train someone else who's going to go out and care for patients. You know what I mean? It's almost like, to me, the best of all worlds.
Right.
And then even some of the research that I was doing, when it got published, sometimes back then, we didn't have the ability to, back then, to get journal articles, print them out, just go online and print them out. So when you published an article in a peer-reviewed journal and somebody wanted a reprint, they would write to you. So a few of my early articles, I would be getting a request for a reprint from on the other side of the world. And, I said, wow, I can't believe that what I'm doing is having that outreach. So this is why a career in academic medicine is so exciting. I could see patients that I love. I can train. Our medical students, to me, are an inspiration. I'm sure you are, okay? Akito, an inspiration. But I see in them a zest to want to help and care for people. And for me, to be able to help to shape them, guide them, and teach them in academic medicine, I'm helping patients. And then if I could be involved in discovery of something in some way, even peripheral, because I'm not a researcher by heart, but I participate in research. You know what I mean?
Yes.
So that's why we need in osteopathic medicine young men and women, physicians who are choosing careers in academic medicine, because, we're rapidly growing and we need teachers, researchers, clinicians to be. So I have found, I'm going to tell you that this career for me I tell our students, I told my kids too, I have 4 grown kids when they were little, I said, when I wake up in the morning to go to work, I never feel like it's work. I feel like I want to go. And that's been my whole experience. It still is today. I want to go to work. But anyway, it's been an amazing career in osteopathic medicine and in osteopathic academic medicine. So I'm trying to encourage, a number of our students to choose careers in there. But, it's something you have to fall into and experience.
Thank you so much for such a detailed answer and such a passionate answer. In our last 2 minutes or so, I just have one last question for you. And this is one we ask everyone. This is our final question. What was the best piece of advice that you have received throughout your education, whether it was growing up, in college, in medical school, or in your training, that you always think of and would like to pass on to our pre-med and medical student listeners?
I would say to really find your dream and give it your all and stick to it wholeheartedly. Going way back to high school, I knew I wanted to be a doctor, and that was my dream. And it took a lot of hard work, commitment, and persistence. And I got there. And I viewed being a physician as a calling, as a vocation, and almost like 2 movies I liked as a young kid, Man of La Mancha, as well as Sound of Music. And it was all about wanting to do good in the world. And the way I felt I could do that was being a physician. So it's really, for me, it was finding your dream that requires your all and gives you a lot of satisfaction, that enables you to impact greatly in the world, and follow your dream. Be committed wholeheartedly and persistent. And, it really has given me a life that I've been very grateful to be able to be an osteopathic physician and then to have this career pathway that I've been able to have.
Dr. Cavalierey, thank you so much for your time and such an inspiring interview. It's certainly given me a lot to think about, and I'm sure it's giving our listeners a lot to think about. But thank you so much for taking time out of your day.
Well, listen, it's good to be with you. Thank you for doing this, and good luck to you as you pursue your residency training. Congratulations. And I could tell from interacting you have that spirit of wanting to be a great doctor. So good luck.
I think we all want to work together to better our profession and spread the good word of osteopathic medicine. Thank you so much, Dr. Cavaliere. Thank you so much.
Pleasure to be with you. Bye-bye.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there is someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.